Hi everyone, it's Dr. Jason Cook here at Newington Medical. I'm just doing a live update from Newington, from here at the practice, just regarding the coronavirus disaster that we're facing at the moment. Obviously, people are very anxious about what's happening and whether it's going to spread through the community and what the death toll is doing and things like that. The video that I did with Dr. Helen on Friday was very popular, so I've decided to keep doing these videos just to keep people abreast of what's going on at the coalface in general practice. I guess one of the things that came up today was I had somebody turn up whose employer was demanding they be certified free from coronavirus. We in general practice are not able to do that because we don't have testing facilities for starters, plus we have to satisfy criteria by New South Wales Health in order to refer for testing. So the current criteria are that you have to have been overseas in the last 2 weeks, or you have to have come in contact with a known coronavirus case. Plus you have to have symptoms. So symptoms could include fever, cough, sore throat, typically not runny nose. It doesn't seem to cause runny nose, but mostly it's cough, fever, and sore throat. Certainly shortness of breath, or if you get more severe symptoms, then that might indicate a reason to test. But the criteria have to be fulfilled in order for New South Wales Health to do a test for coronavirus. So that is currently, and this might change, like this is very, very dynamic. So it could change tomorrow, it could change next week, but at the moment, you have to have been overseas in the last fortnight, or you have to have come in contact with a known coronavirus case. And the reason being is that there is a finite amount of testing kits available. So the government has to stratify the risk in order to get a higher pre-test probability of it being positive. Otherwise, if it was up to me, it would be great if we could test everyone and exclude the coronavirus from anyone who's got this kind of symptoms. But unfortunately, we can't do that. And there are a lot of people presenting with coughs and colds and runny noses, kids with runny noses. It's like that's the usual kind of things that will present in general practice. Will continue to present. This just adds another layer of burden onto the health system, and a significant one at that. Now, if you tuned into my previous broadcast on Friday, I made it clear that this is a version of SARS, which is severe acute respiratory syndrome, which happened in 2002 in Hong Kong and China. It used to be called severe adult respiratory syndrome, and I believe they changed it to severe acute respiratory syndrome, because what happens is the virus gets into the lungs, and as it replicates, it destroys it destroys parts of the lung deep down, and it causes a lot of inflammation. So when you get inflammation, you get fluid accumulation inside the lungs, and that prevents gas exchange at the lungs. So that's why people need to be on ventilators if they get this particular consequence of this virus, because you have to literally force air under pressure into the lungs in order for them to survive, and they force air under pressure with these ventilators under pressure and with oxygen, mind you, to maximize what little capacity would be left if the lungs fill up with fluid and this kind of thing. And this is why people talking about flattening the curve. In other words, because we only have a finite number of ventilators. I was even thinking about maybe they could get some ventilators that have been retired from the 80s, the old Billows ventilator. We might have to resort to that, I don't know, but hopefully not. But they've only got a finite number of ventilators. So the issue is if you do get it and you have a reaction that predisposes you to getting this viral pneumonia, basically, where you get fluid accumulation in the lungs from being attacked by this virus, you need to have a tube put down the throat and force air into the lungs to survive. Otherwise, you can't exchange gases and then people die. That's the mechanism of how people die in these circumstances. So that's why the death rate would go up if you don't have high standard of medical care available. And this is why the government has taken this very seriously, because if we can't slow the spread, we're going to get this enormous peak of infection, and a percentage of those people, it might only be 1% or even 0.5%. But what's 0.5% of 1 million people? It's a lot of people. 1% is what? 10,000 people. That's 5,000 people who might, get sick very quickly, and we just don't have that kind of capacity. No country does. You can't plan for that kind of thing. So that's why it's very important that this is taken very seriously. And I know it's obviously very inconvenient. A lot of people don't understand, it's not, it just causes cold and flu symptoms. But just based on latest statistics, we've got 170,000 infections so far, with 6,500 deaths. So that's an equivalent, that's approximately about 3.5%, maybe 4% death rate. That's very high in my opinion. I made the point that I wouldn't want to take those kinds of odds of getting a viral infection. So that's why it's very important that, for the most part, most people will be fine. But if you're unlucky, if your immune system is such that you react in a way that causes you to get this viral pneumonia, well, then you're going to be, and we don't know, we can't stratify. We don't know who's going to react poorly and who's going to just, like Richard Wilkins, got no symptoms apparently. Well, lucky for him. What about the rest of us? It's just, there's no way of knowing. We just don't know. We know that we've learned from Helen that children don't die from this particular virus, which is fantastic. But certainly after 40, we start to get into a much higher risk, and between sort of 18 and 40, the risk is around 0.5%. So that's still pretty high. Even 0.2% is still pretty high when you think about very large numbers of people infected. So that's why we have to take this very. I know it's hassle, and people don't understand why we have to do this, but the consequences, as it being played out in Europe and as it played out in China, are disastrous. And I would ask people to go YouTube and look up SARS, SARS, SARS 2002, and just see what and fortunately they were able to contain that virus. That particular virus was not as easily transmissible between people. This incarnation of SARS is much more contagious. It's not as deadly. That one was about 10% for case fatality. This one's somewhere in the order of, depends on how old you are, but we're seeing overall death rates in the order of about 4%, which is very high. So when you have numbers in that kind of magnitude, and not only that, if you combine that with other comorbidities or other illnesses, then the case fatality rate will be much higher. And we have an upcoming flu season coming up, which I'm not looking forward to. But I just hope that everyone, as soon as these vaccines, the flu vaccines, become available, as many people as possible get vaccinated against that. Because that, if you combine a flu infection with potential coronavirus infection, that could get into the lungs and cause this viral pneumonitis, and that you've got dual infection, and it's more difficult for your immune system to overcome because you're basically fighting on two fronts. Could even be a third front if you get a secondary bacterial infection. So you could be fighting on three fronts. So this is the kind of thing that we're having to consider when it comes to dealing with this scourge. It's an absolute scourge, and so I think the salient thing now, the government has had to ration out the testing because there's just not enough testing kits to test everybody. It would be ideal, but we can't get enough. So we've had to introduce some kind of rationing out of how we're going to test people. So in general practice, if we're assessing somebody, we look at their symptoms, we look at whether they've been travelling in the last fortnight, and certainly if they've been in contact with anyone who's been diagnosed. And then if yes, symptoms, and yes, been travelling in the last 2 weeks, then yes, get a test. Then I'd refer them to the coronavirus testing stations, which is the closest one to here is at Concord Hospital. They're not doing it across the road. I thought they were going to do it, but they've chickened out. I don't know what happened, but it's not happening. It's not being able to be performed here in private practice. So if you fulfill those criteria, then yes, get a test. And so you have to have symptoms as well. So you have to have like fever, coughing, shortness of breath or something of that nature, plus the travel history or being exposed. So for the most part, most people don't really qualify for that reason based on that stratification that the government has imposed. So that isn't to say though that these people don't have it. I can't certify somebody. I can say, well, you probably don't have it based on your symptoms or based on your travel history, but we have to consider that the people who test positive now were infected 2 weeks ago. So people who are positive now, we won't find out for 2 weeks. So the numbers could be like 20 times more than what they are. So this is why we have to really knock this on the head as soon as possible. I don't know if we can. It might be too late. I'm disappointed that it's been able to get out of China. It's a shame. I would have hoped that they learned the lessons from SARS back in 2002, but I think they have learned lessons. But obviously, perhaps because this virus is so much more contagious, it was much harder to contain for that reason. That's the only thing I can think of why it's been able to propagate in such a rapid fashion. Yeah, so if employers want us to certify people don't have coronavirus, we can't do that. All we can say is that they don't fulfill the criteria for New South Wales Health to be tested for coronavirus, but I can't know 100% whether somebody's got coronavirus or not. It's probably unlikely if they don't have that travel history and they haven't been exposed. It makes it unlikely because at the moment we don't have many cases. We've only got diagnosed cases about, I think, up around 200 odd, but the numbers could be a lot higher because we've got that 14-day latency period, because we just don't. If you test positive, then you've been infected in the last sort of 1 or 2 weeks. So that's a limitation. So these rules that the government's put on kind of 500 people in mass gatherings, it's all arbitrary. It's all kind of, risk stratification. Because if you have a gathering of 500 people and just one of them's, got coronavirus, well, you're looking at like a minor epidemic that if you have 500 people, they could all be infected. So it's arbitrary. It's like, well, we'll cap it at 500. That seems reasonable. But ideally, we don't know. We just don't know. I mean, that's why the government's saying, and us, the healthcare professionals, we're saying if you have symptoms, if you have fever, if you have certainly cough, certainly shortness of breath or anything like that, certainly get assessed, but don't go to work. Don't potentially expose other people to well, it's probably not coronavirus, but you shouldn't be exposing people to other viral infections anyway. That's just like, that would be a good thing to do regardless of coronavirus. So we don't certify it. Those are the New South Wales Health directives in terms of testing for it. And at this stage, it would make sense to close up everything. If we closed up everything for 2 or 3 weeks or even a month, we could potentially knock it on the head. But then, in other countries overseas who are not as responsible, they're going to have probably endemic disease. So I don't know what the solution is. it's a freaking nightmare, to be honest. But we just have to try and manage as best we can. Wash our hands. Hand washing is much better than using this alcohol rub. This is okay, like if you don't have access to a sink or soap, but please, soap and water. You must use soap and wash hands thoroughly. Children should wash hands as well, because they're vectors for transmission of coronavirus and other viral illnesses to adults. So we should wash hands regularly, wipe down surfaces, use hand sanitizer if you can't wash your hands, if it's not available, like in the car or something like that. I'll be wiping down any surface where I'm handling as much as possible. And that will help prevent spread of not only coronavirus, but other viral illnesses. I think this is a good thing for society as a whole, to take infection control more seriously. So I think that's about it for now. I'll endeavour to do an update maybe every 1 or 2 days, just depending on if there's new information. But that's about it for now. And that's all we can do. And I honestly wish the government would give us more masks. They have not provided us with any masks. I would like to be able to provide any patient with a cough a mask if they come into the surgery. I'm currently doing that, but I'm down to about I think I've got about maybe 15 or 20 left. So that's how the government could help general practice manage this scourge, but they haven't done that. I don't know why. They'd say, go to your GP, they don't provide us with masks. So I know they've got very limited supply, but I don't know, we're just managing the best we can. So, and we're asking patients to wash their hands, cough in there, like this. So that's where we're at this stage. So I'll update this maybe in the next day or two. Good night.